Welcome to PCR London Valve 2025. Today I have in the studio here Varius Dannenberg from Vienna and Matti from Cologne. And we're here to talk about the updated EACTS guidelines and how it has impacted, I think, our tricuspid valve patients and our management of these patients. So I want to start with Varius and ask him what he thinks about the guidelines, how we updated them, what data is behind it, and what he thinks in general about the management now of tricuspid regurgitation.
Yes, thank you very much. Very important question. In the recent update, we got an upgrade for the TV interventions from grade 2B to grade 2A. With a recommendation grade A, because we have now two randomized controlled trials which could show that there's improvement in quality of life after tricuspid interventions. And especially the 2 years outcome data of the TRILUMINATE pivotal trial are very interesting because we see there also a hard endpoint for the first time, a reduction in heart failure hospitalization rate. And for me, in my clinical practice, it was very interesting because I also presented these results at the local congress in Vienna. And afterwards, a lot of practitioners came to me and asked me, what's the fastest way to send patients to you? So I think it will affect me that there will be more referrals. There will be also more awareness.
Yeah, it seems as though the endpoints of 1 year for the trials might have been a little short. And so the TRILUMINATE trial, that it was that 2 years. Do we have any further data now for other device therapies that might help us also support the guidelines?
Yes, very interesting. Yes. We have the TRISCEND study, TRISCEND II study actually. And in the 1 year's outcome, we saw already that there's improvement in quality of life, actually a lot, like 18 points or so KCCQ score. So very important improvement in quality of life. And now we have the 18-month data sub-analysis, and we could see that patients with massive interventional TR seems to profit more. Especially they could show a reduction in heart failure hospitalization again. And so in clinical practice, I think I will focus more on this group. And we know also from other data that a low TRI-score is actually, they seems to profit more if they have a low TRI-score. So if you are rather early in the stage of the disease and have a larger TR grade, then you should go rather to intervention, I think. Maybe we should focus on this early phase after tricuspid valve replacement, and maybe they need more follow-ups very early. So we maybe should also avoid to reduce diuretics too early. So this could be a reason why there's so much hospitalization events early.
Yes.
Maybe we have to improve that, and then we can even improve more and more avoid the hospitalizations.
Excellent point, excellent point. Yeah, I think that we still have work to do as far as medical management of these patients, right?
Yeah.
But I wonder if there's any real world data that can help us here. I don't know, Matti, if you've seen the data from the real world, is this what your practice sees?
Well, absolutely. I mean, it's a great question. So there's recent data on TTVR as well with the EVOQUE system from the European Experience Centers and from the TVT registry. And that's actually super promising because I think while it's big numbers, it's over 150 in Europe and more than 1,000 patients in the TVT registry, complications like bleeding goes down. We still have a fantastic reduction in TR. Bleeding complications goes down, pacemaker rates go down. So while we have to worry a little bit about underreporting in registries and stuff like that, I still think it's a promising result. And I feel that this strengthens TTVR as a therapy in patients that have complex anatomies, glide scores more than 2 and 3, because those are the patients we cannot treat very efficiently with TEER, I think.
Yeah, it seems as though, with the TTVR devices, we're able to get TR down to mild, and the TVT registry was like 98%. It was even higher than in the randomized controlled trials. Again, site reported as you've mentioned. But I think the consistent efficacy of the device distinguishes it somewhat from TEER. And you mentioned that we're not able to really have as much consistency sometimes with the TEER.
Absolutely, and we know that this is important for our patients. They will profit more if we can reduce TR more efficiently. So I think that's a very important point. The efficiency of the device is super important.
Excellent. So this has been a wonderful discussion. I really enjoyed it. I think we now have evidence that not only the heart team is the center of maybe the decision making for our tricuspid valve patients, but also that we have a 2A recommendation now for treating them with TTVI. And I think this will really help the patients that are coming to us with severe symptomatic disease. Thanks for coming.
Thank you.
Thank you.